Well, I was intrigued by a comment you just made. You said that we're going to change the way we finance the system by taking money away from people who are doing well now. Who specifically are you talking about?
Well, let's start with the insurance companies. The insurance companies make money by spending a lot of money and employing a lot of people to try to avoid insuring you, and then if you're insured, to try to avoid paying for the health care you received. And I see this all the time. You know, my office spends a lot of effort helping people who have insurance get health care. Two quick examples. Father called me from northern New York, had a son with a very serious ailment. He was well insured. He had worked for a long time for the same employer who gave him a good policy. His son needed a special operation, and the insurance company said, no, we're not going to pay for that. There was only one place in the country that really could perform it, and the insurance company said, I'm sorry, that's out of network. You've heard that. We're not going to send you to have that done. So my office intervened, and you know, we get a little bit of attention when I call, and we said, you know, we don't think this is right. This man has paid his, you know, share of his premiums. His employer has bargained for this insurance coverage. So, make a long story short, we got the operation, but I just don't think that people should have to go to their United States senator to get their insurance company to pay for what they deserve to have. Second fast story. We are having an epidemic of diabetes. You all know that. We have young people being diagnosed with adult onset diabetes. I'm talking 12, 13, 15, 16-year-olds. We are seeing the cost of diabetes go up exponentially. Well, a lot of insurance companies will not pay for someone who's pre-diabetic or been diagnosed with diabetes to go to a nutritionist to find out how better to feed themselves and their families, to go to a podiatrist to have their feet checked. But they will pay if you have to have your foot amputated. Because the reasoning is, and the insurance companies will tell you this, they don't want to pay for preventive health care because that's like a lost amount of money because they're not sure that the patient or the insured person will still be with them. But if they're confronted with the doctor saying we're going to have to amputate the foot, they're kind of stuck with it. That is upside down and backwards. So we could save money if we change the incentives to require that preventive health care and wellness be covered and incentivized, and we could require that every insurance company had to insure everybody and no exclusions for pre-existing conditions. And that would be one thing we could do.
Well, speaking of the way it's financed, when you do come up with your plan this time, is it going to once again include what was the most controversial aspect of your plan last time, which was this employer mandate, a requirement that companies cover their workers? And will it also have an individual mandate, the way people have to buy auto insurance, and the model that we've seen that put forward in Massachusetts and California?
Well, there are only a couple of ways to get to universal coverage. And I'm pleased that a lot of the people on the Democratic side, both running for president and in the Congress, are saying, look, we got to do one of a couple of things. If we're going to build on the employer-based system, no more free riders, no more companies that don't insure everybody and shift their costs onto other companies that do and onto the taxpayer. So every employer is going to have to provide insurance or pay into a pool where that money can be used to help people. And we may have to say, look, it is everybody's responsibility to be insured. You know, and sometimes young people come up to me, and I understand this. I vaguely remember being young one time. And they say things like, you know, I'm healthy, I don't need insurance. I'll say, well, do you drive in cars? Hey, have you ever driven a motorcycle? Do you walk across the street and sometimes not look at the light? You have no idea what can happen to you. Insurance is supposed to be available to make sure that when something happens to you, you'll be taken care of. And frankly, it is to protect the rest of us who are taking care of ourselves. We're being responsible. So I've been impressed that on both ends of our country, in Massachusetts and in California, an idea that we first floated back in '93 and '94, which was to say, look, individuals have to be responsible, so if your employer doesn't provide it, and if you're not covered by one of the government-funded programs, then you're going to have to be in the system. Because otherwise, if something does happen to you, you're going to be the responsibility of everybody else. So the so-called individual mandate is really the individual responsibility policy. I think that has to be looked at as well. But we also need to look at how we provide an alternative for businesses that are not going to provide health insurance, and their people are not going to have it, and where can they go to get a good policy? Well, we have two really good programs operating right now. Medicare, which takes care of people over 65, has the lowest administrative costs of any insurance program. You know, when you look at how much private insurance charges for administration and overhead and profit, of course, you compare it with Medicare, there's no comparison. Medicare is like 3% compared to anything from 10 to 35 or up. And we have something called the Federal Employees Health Benefit Plan, where people like members of Congress and people who work for the federal government, they can go into this pool, that's what it's called, it's a big sharing arrangement, and they can have a lot of different choices. And then they can pick what kind of insurance policy. And if they're young and they think they only need catastrophic care because that's all they're worried about, they can get that. If they have kids with some kind of problem, they can get coverage for that. So we can look at how we provide a backup, government-sponsored approach to complement the employer system if we stay with the employer system. And the final thing I'd say about that is, you know, one of the things that happened in '93 and '94 is that people thought that, even though this wasn't the case, but we didn't do a good enough job explaining it, and we're going to do a better job this time, people thought, well, they're going to be required to change what they had, and a lot of people like what they have. So we don't want to have people feeling like, oh my goodness, the government's going to come in and they're going to tell me what I have to do and what doctor I have to go to. That was never, ever part of the plan, but some people got worried about that. So building on what we have and having a bridge to make sure everybody's included, and at the end of that bridge, having an alternative that is a government-sponsored alternative gives people choice. So that's what I think we have to look at as a framework, because really every plan you're going to hear about has some combination of those elements.